Context for the debate. Physician-assisted suicide, also called PAS or just assisted suicide, is a medical procedure where a patient, who's usually terminal, chooses to want to end their life. This usually goes as followed. The physician, if they agree to go along with the procedure, will give a prescription of a high dose of barbiturate powder mixed with water. The patient may self-administer the medication at home. The patient will fall asleep after taking the medication and will pass within the next few hours, according to Psychology Today. Allowing physician-assisted suicide to be legalized is immoral. It's an act of homicide. It goes against ethics and even goes against the Declaration of Geneva, the code that doctors should follow all the time. It should stay illegal. On the contrary, physician-assisted suicide should be legalized because death with dignity should be a choice for a patient. It gives people self-determination in a system where people can't normally find that. It cannot be homicide if it's a choice by the patient. Consensual murder, although the topic is largely debated in the legal system, is still illegal and should stay that way. If a regular citizen can be arrested and convicted for murder, even if the victim consented, it should be the same with doctors. For example, the story of Sharon Laptka, who had asked to be tortured and killed. Despite the fact that Laptka had asked for it, her murderer had received a charge of manslaughter. Originally was supposed to be first-degree murder, but was changed to manslaughter and sexual exploitation instead. He served 2 years in prison, but died in prison. Why should a doctor do the same thing with no consequences? The difference between assisted suicide and consensual murder is that one is peaceful and one is usually not. Laptka was strangled and buried in the murderer's backyard. Her family didn't know about her whereabouts. Physician-assisted suicide is painless. One doctor, Chantal Perrot, who performs physician-assisted suicides in Canada, shares the process. She says the patient is given a sedative and then injected with lidocaine. She finally injects them with propofol, which sends the patient into a deep coma. Doctors usually take the extra steps to assure that the patient's death is completely peaceful. But how can we be sure the patient really wants it? What if they change their mind? And how can we tell the patient is of sound mind? In a research paper written by Margaret Drichmer, Melinda Lee, and Linda Grausen, they discuss how dementia and delirium may impair a person's decision-making abilities. Both of these conditions may cause someone to decide they want physician-assisted suicide, but not actually want it. Finding ways around dementia and delirium when it comes to physician-assisted suicide would be extremely difficult, as delirium is found in immunocompromised individuals and those with cancer, and it's under research and underdiagnosed. While dementia does cause impairments in thought, within the same study, the researcher states that in cases of dementia, the patients who choose physician-assisted suicide were in their early stages of dementia. They had impairments within their thinking, but were still aware of these impairments. Many of these dementia patients chose physician-assisted suicide in their early stages due to the fact that they knew their further deterioration was inevitable. Physician-assisted suicide gives patients the ability to choose a death with dignity if they know their condition will only worsen. The issue that occurs with the idea of physician-assisted suicide is that there is an alternative, one that is similar to physician-assisted suicide but keeps the patient alive. Palliative care, also known a type of healthcare that focuses on comfortability with terminally ill patients, exists, and it keeps the patient alive painlessly. While there's an argument that physician-assisted suicide helps eliminate pain, palliative care does too. These end-of-life patients are given medicines such as morphine as well as other opioids to help eliminate pain, and if used with control and supervision, can be extremely effective. Even though palliative care helps with physical pain, how does it help with the mental and emotional issues that come with a diagnosis that is a death sentence for the patient? Palliative care also focuses on the mental health side of end-of-life care. On the topic of mental health, there is little to no assessment on a patient going through physician-assisted suicide to see if their decision is related to their mental health. In Oregon, one of the states where physician-assisted suicide is legalized, nearly 50% of people going through with assisted suicide say their decision is due to the feeling that them and their illness is a burden on others. At the end of the debate, it's inevitably the patient's decision on what they want. It's their choice on if death or life is the best way to go down with their treatment.